Welcome back. My name is Dr. Virginia Hatch-Pigott, and we are entering the 5th portion of our training series. This is for licensed practitioners, and this is module 35, Intake and History for the Neurofeedback Practitioner. Now, most of you as licensed practitioners have a lot of experience with intakes or history and physical if you are a physician, but I thought I'd go over what we do here at Scottsdale Neurofeedback Institute so that if you like what we do, you can incorporate some of what I'm sharing. And I just want to stress some things that are very important, particularly for neurofeedback. So when we first see the client, we generally start by asking, what is the number one reason you are here? Or if we could help you with one brain-based issue that you're dealing with, what would it be? And people are very quick to tell you anxiety or my attention, or they'll name ADHD because they've already been diagnosed previously. So that's usually easy to elicit, and then we just go down the second, third, fourth thing that we could help you with. And I will present after this slide some questions to help you really drill down on those concerns. But here I'd like to really stress the importance of past medical history. How was mom's pregnancy with that individual, even if they're an adult? This is very important. We have people in their 50s and 60s that know they were premature babies or it was a very difficult delivery, and that has an impact on the brain. We want to know about developmental milestones. Did they roll over on time, crawl on time, walk on time, say their first words around 1 year, start putting sentences together around 2 years, pedal a tricycle around 3 years? So really know developmental milestones and find out if the individual met all of their developmental milestones. Another way to ask that is, did you need speech and language therapy or physical therapy or take any special education classes? Did the individual have any hospitalizations or were there any surgeries? This can then elucidate, well, did you have meningitis? Did you take antibiotics? Strep infection is very important. There is a illness called PANDAS, which I'll let you do a deep dive on your own, that can trigger depression, anxiety, and OCD, very common brain-based disorder with PANDAS. So you can look into that. Current health, do they have any allergies? Are they exercising? Exercise has a profound effect on our brain health, especially in later life. There are studies that show that people who exercise for 30 minutes a day offset dementia, age-related dementia. So we know that exercise has a profound effect. Are they doing any drugs or alcohol? Activities, do they play music? Are they involved in sports? How's their appetite? Do they have a history of headaches or currently struggle with headaches? Past head injuries, very important. We can see that on brain maps. And then, of course, their diet, which also has a profound effect on the brain map and therefore brain functioning. We know that a a Mediterranean type diet that's really high in antioxidants, fruits and vegetables, is quite beneficial for the brain. And then sleep. People should be getting at least 8 hours of sleep a night. Before the electric light bulb, people were regularly sleeping 11, 12 hours a day. So very important. Do they go to bed at the same time? Do they wake up at about the same time? Or maybe they're actually coming to you because they're struggling with insomnia. Next, really important, what medications are they on? What supplements do they take? That might reveal other past medical history or current history items that they may not have mentioned. Social history, who are they living with? Do they have any hobbies, play any sports? And then family history, extremely important. We know now that a lot of mental illnesses, if not all, are inherited. ADHD, anxiety, depression, OCD, tics, seizures, just all extremely heritable. Also ask about siblings and grandparents. And specifically ask about their mental health history. So if anxiety is probably the number one in adults, the number one thing that people seek mental health care for. So if they say anxiety and you ask them, can you describe how that manifests for you, and they can't come up with a whole lot, or they come up with very little, here are some questions that you can ask. Do you feel like you worry more than others? Do you feel jumpy or on edge? Do you experience racing thoughts? Do you experience sweaty palms or pounding heart? And specifically, is it in certain situations, such as social situations? Do you worry about senseless things? Do you struggle with increased muscle tension? A lot of people have a lot of aches and pains because of chronic muscle tension. Do you have trouble relaxing? Do you avoid things that make you nervous or trigger feelings of anxiety? Do other people tell you that you worry too much? Do your fears keep you from doing things that you don't want to do? Do your fears interfere with relationships? Do you have fear of relationships? Do you become easily annoyed or irritable? Do you struggle with feelings of doom? Do you have a hard time letting go of things or ruminate on fears? Now, if this is an adult coming to you, this is how you would pose the question. Sometimes I'm asking the question as if, does the student or your child? Obviously, you flip the first person, third person based on who you are talking about, obviously. So if we're talking about a child, does your child worry more than others? Does your child say they feel jumpy or on edge? Does your child say they experience racing thoughts? Depression, probably the second most common reason people come and see you. And again, if you ask, how does that look for you? How do you experience depression? Can you tell me more? If they can't elaborate, do you feel down, depressed, or hopeless many days or most days? Do you feel tired or have little energy? Do you have trouble falling asleep, staying asleep, or the opposite? Some people with depression sleep too much. Do you have trouble experiencing joy? Do you feel bad about yourself or feel like you're a failure? Do you struggle with feelings of worthlessness? Do you struggle with other negative thoughts about yourself? Do people often ask, what's wrong? Is everything okay? Do you have trouble concentrating on your work or school? Do you find yourself isolating from your friends and family members? Again, do you become easily annoyed or irritable? And do you have thoughts of dying, or that you would be that dying would be better than living? And if you get a positive response to this, obviously you need to have some follow-up questions like, have you ever attempted suicide, or have you thought of suicide? And if that is positive, you should ask, and you must ask, do you have any current plans? If they do, then you need to discuss getting them stopping the intake immediately and talking to them about checking into a psychiatric emergency room. So know the psychiatric hospitals in your area and where to send people if they are actively suicidal. Now, there's a lot, you're going to notice a lot of overlap in questions, and that's because there's a lot of overlap in comorbidities with multiple disorders. So this is intake questions for OCD, and oftentimes people don't know that they have OCD or are on the OCD spectrum. But if they ruminate about fears, it'll manifest it as anxiety. If they ruminate about negative thoughts, it will manifest as depression. But oftentimes it's a little more obvious, such as, do you worry excessively or senselessly, for example, about diseases, germs, or poisons? And oftentimes people with OCD know that their worrying is excessive or senseless, but they can't stop it. Do you get upset when things don't go your way? People with OCD are often very rigid, and it's very uncomfortable and nerve-wracking to have things not go a certain way. Do you tend to have repetitive negative thoughts? Do you have a tendency to hold grudges? These individuals oftentimes, not always, will replay over and over a hurt that somebody's done to them. Do others say you have a hard time letting go of things? Do you get very upset when things don't go a certain way, like the way people are going to drive or the traffic that day? Do you have a tendency to predict negative outcomes? A lot of individuals with OCD have what we call catastrophic thinking. Do you have a tendency to always do things a certain way or in a certain order? Do you have a tendency to check things to make sure that they were completed or done a certain way? Would you or other people describe yourself as a perfectionist? Do you have trouble delegating tasks for fear that they would not be done well enough? Do you get upset when things are out of place? Do you count things for no reason? Do you have to check things repeatedly? Do you avoid things for fear of triggering a negative reaction in yourself or others? Are you impatient, irritable, or moody? Do other people think you're judgmental or think you act like a police officer? Do you have any compulsive behaviors or things that you have to complete before you can relax? So people will say things like, no, my house has to be clean or I can't go to bed. My kitchen has to be clean or I can't leave the house. Do you compulsively shop or research things on the internet excessively? These are questions that may not be obvious to people. Other things are that are on the OCD spectrum are compulsively picking skin, pulling hair, that's trichotillomania, or skin picking, excoriation disorder. And the amount of symptoms are vast. I think OCD is one of the most misunderstood mental health disorders that's out there. So intake questions for ADHD, and this is going to be in third person because oftentimes with ADHD, we have parents coming in for kids that are struggling in school. So there are over 200 symptoms associated with ADHD, and sometimes, especially if it's without hyperactivity, these kids will get overlooked for a very long time. And we oftentimes have adults that come in that have ADHD that have been overlooked because they're highly intelligent and they have figured out workarounds. However, their life would still be a lot easier if their ADHD were treated because things take a lot longer and they do drop the ball often because of chronic procrastination or having their mind wander excessively. So here are the questions for ADHD. Does the student know what homework is required and is it brought home and done without prompting? Does the student lie about homework? Like, I don't have any, or it's already done. What % of the time does the student initiate homework on their own? Is it a battle to get the student started on homework? Does the student procrastinate or have delay strategies that are utilized? Does the student read the directions thoroughly on their own? Or do they just rush through? Does the student write their name and the date on the top of their homework without prompting? Here's an example. If the student has a 20-minute homework assignment with no supervision, how long would it take them to successfully complete the task? And if the student thought that the parents were gone, how long would they stay focused? When a student has a 20-minute homework assignment with one-on-one supervision, how long does it take to successfully complete the task? What is the student's quality of work? Do they rush through, just do the minimum to get it over with? How is the student's penmanship? Do they have dysgraphia or do they just rush through? If the student makes too many mistakes, what is their attitude? Taking time to check and correct their work? Do they even care? When it's all incorrect and the student has to erase and redo, what is their response? If the homework is completed and it's left, is the homework completed? If it's left on the table, will they grab it and put it in their backpack? Would the student go back and place it in their backpack and return and turn it into their teacher? I know today a lot of students are able to just turn things in online. And I've had parents say they'll do it, but they don't even, it just takes a click to put it in the Dropbox online, and they can't, they'll oftentimes forget to do that. Now, without reminding, would they make their bed? Do they put their dirty clothes in the hamper? Do they hang up the towel after their shower? Do they hang up their clean clothes or put them away in their dresser? Do they turn off lights? Do they pick up after themselves? Do they put lids on tightly? Do they put food back in the refrigerator? Say they took out the milk or the orange juice. Does it make it back in the refrigerator? Or food that they take out of the pantry, does it make it back into the pantry? How long will the student go until they must be prompted to brush their teeth? Would they not brush their teeth for a week if you didn't tell them every night? How long does the student go until they must be prompted to take showers? A lot of kids with ADHD, even teenagers that are 17, their parents will complain that they lack hygiene issues. It's just too much work for them to take a shower and do their hair. Does the student put clean clothes on? Can the student clean their own room satisfactorily? Does the student do their chores, especially without being told? Is the student impulsive? Can the student sit still in school? Or do they, teachers complain that they're always up out of their seat? Does the student have good listening skills? How many times do you have to tell them something? If the student needs to get things from the kitchen, for example, a banana, a glass of water, and a napkin, and you put the movie on pause, how many things would they return with after the first request? Is the student's school performance up to their potential? Now, we're going to move on to learning disabilities. ADHD oftentimes has comorbid learning disability. And here are the questions that we should ask. If attention, even if the parent doesn't bring it up, if attention is an issue, does the student say what a lot or seem not to understand what he or she is being told? That's auditory processing disorder. Does the student have trouble writing letters and numbers or seem to reverse them or flip them? So the first would be dysgraphia or dyslexia. Does the student have trouble reading? Visual processing disorder. Does the student struggle in math? Dyscalculia. How is the student's handwriting and drawing skills? Dysgraphia. Is the student able to express themselves verbally and carry on a good back and forth conversation? So that could be an expressive language problem. Is the student able to retain what he or she is being taught? Memory issues. And does the student struggle to remember past events, names, or plans that you may have for the day or the week, or even over for the next month, maybe for vacation? A lot of these questions you could ask also for individuals that have had head trauma or stroke. A lot of people with head trauma or stroke have attention issues and memory issues, and may even have some new onset what we would be the same as a learning disability, dysgraphia, dyslexia, expressive language problems. Intake questions for facial recognition dysfunction, which is used to be Asperger's, but Asperger's is now lumped in with autism. And facial recognition dysfunction really isn't part of the autism spectrum. So we ask about social skills. Does the student have friends? Does the student get invited over by classmates? Does the student pick up on social cues, or do the parents say things like they can't read the room? Does the student make eye contact? Does the student initiate and invite friends over? Does the student get overly bossy, or is the student too timid? Does the student share and take turns with others without prompting? Can the student put themselves in another classmate's shoes and show empathy? Does the student blurt out or interrupt? And that is the end of our intake and history. Again, we often like doing a genogram with the mental health disorders or learning disabilities that run in the family. And I will include a PDF of all of these with this lecture so that you can have this in writing. Thanks so much.